Guys, welcome back to Medical Coding with Blue. Today's episode is all about advice to nurses who want to transition from nursing to CDI, or Clinical Documentation Improvement, Clinical Documentation Integrity. Alright, so if you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, if you are a nurse watching this episode and you're thinking of, getting into CDI, people have told you about it, you're interested in it, and then you've heard about medical coding and you wonder if you need to do medical coding first, or can you start off with CDI? What is the deal here? So let us begin. Okay, CDI, Clinical Documentation Improvement, or Clinical Documentation Integrity as it's called. It's interchangeable. People call it two different things, okay? This is a specialized field of taking documentation, looking at it and seeing where there are holes in the documentation so that the provider can get a more specific diagnosis assigned or a more specific procedure code assigned. Now, medical coders normally do this as well, but medical coders are often coming in with just a high school diploma or a GED and a certification, okay? Any one of these. So they don't have, a lot of medical coders do not have the extended training of doctors. I always say to medical coders, we have to know what doctors know while never having gone to medical school. Some medical coders take this very seriously and will go above and beyond to try to learn things about like their particular specialty. But there's something about nurses having all of that additional education and being able to spot things that are missing in the documentation to be able to talk with the provider about. Now, the great thing about nurses and providers is that you already have a built-in relationship. There's going to be this understanding of, okay, I'm the doctor, you're the nurse. And they do have that. That's already their built-in relationship. And with medical coders and doctors, there's a little bit of headbutting because sometimes the medical coder doesn't quite understand what the provider is trying to say, or sometimes the provider doesn't understand why the medical coder needs what they need for coding purposes, okay? And this is where the CDI steps in and says, okay, I'm here to educate. So a good CDI is going to be able to negotiate not just with the provider, but they will also be able to negotiate with the medical coder. Now, there's a lot of CDIs who kind of get caught up in that little mix of like, okay, do I need to listen to what the medical coder has to say? Yes, because the medical coder is the one that is coding this on a day-to-day, and they see a lot of the things that are missing, right? And so it is the medical coder's job to talk with the CDI to build that relationship, because oftentimes that CDI is that mediator between provider and coder. So it is the CDI that is going to the doctor and educating them and basically saying, okay, this is why this is missing, or can we clarify what was happening here? So it's about getting that perfect clarification. And again, that person who does that CDI has got to be able to communicate with both sides of the house, okay, the coders and the providers. And I always say to nurses who want to go into CDI, I'll get many messages. Trust me, guys, my inboxes gets flooded, okay? My Gmail account for my channel, Medical Coding with Blue at Gmail, that gets flooded. The LinkedIn gets flooded. Instagram gets flooded from nurses asking, hey, I want to be a CDI. What's the next step? Okay, if you don't know anything about medical coding, that's your first step. I do recommend that nurses who want to be CDI become a medical coder first. This is not a hard and fast requirement. However, I do think that it is needed and necessary because of the simple fact that if you don't understand where the medical coder is coming from, how can you fully be able to help the provider when you don't quite understand? And yes, while your clinical knowledge will really come in handy at looking at this documentation, you're not going to understand the coding side of the house when you have to look at the codes itself, and then you have to kind of understand why with all of our rules, right? I've seen nurses who want to become medical coders and they will start coding things that are not there. And when I've trained nurses, I tell them, okay, why did you get this? And they said, well, it's because they have this and they have this and they have all these other clinical indicators. Oh, no. That's not the way that it works with coding. We are very literal with coding. We have to see, and it has to be clear. Nothing can be inferred, right? And so because of that, we want to make sure that everything is spelled out. Yes, of course, medical coders do need to elevate their game when it comes to understanding medical terminology and anatomy and that kind of thing. But it also does come in handy if a nurse who's wanting to go to CDI also understands those medical coding rules. So that's where, if you're asking me my advice on where you should start first, if you are wanting to be a CDI, is that you start off in medical coding. Now, there's a lot of places that love to see nurses who want to become medical coders because that's that built-in knowledge already there with anatomy and medical terminology and your pathophysiology. So it's easier sometimes to understand the documentation. However, it doesn't always translate into just because you're a nurse, you're going to be a great medical coder. I've seen a lot of nurses who struggle with medical coding because it is so difficult to understand. So compound that with, okay, now you want to be a CDI. So that's why I say start off in medical coding first. There is the American Health Information Management Association, which is what I recommend for nurses. They do have the CCS, which is Certified Coding Specialist, and that is the gold standard of medical coding credentials. They also have the CCSP, which is the Certified Coding Specialist Physician-Based. Now, these are the two I'm going to recommend for nurses, only because of their advanced knowledge, they should be able to go for, after they've been trained for the CCS. That is both inpatient and outpatient coding. However, if you are not comfortable with coding for the inpatient side of the house, there is the CCSP, which is a Certified Coding Specialist Physician-Based, and that is all the outpatient medical coding. That is all CPT coding. That is, again, outpatient, and so you won't have to worry about building codes or doing any of those things. So there's those two options for nurses. I recommend that one with AHIMA because I think that I've seen a lot more nurses be more successful that way. That's just my advice, guys. You just need one, the CCS or the CCSP, either one of these. And both of them, they're great credentials. They get asked for all the time. The CCS is asked for 99% of the time, and you can look in the job listings for that. But start there. And then AHIMA does have their CDIP, or Clinical Documentation Improvement Practitioner certification. And yes, while you are fully able to go after that if you like, I do recommend, if I'm going to recommend CDI credentials, I do recommend the ones through ACDIS, or the Association for Clinical Documentation Improvement Specialists, and that I will recommend over AHIMA credential, the CDIP. So ACDIS does have the CCDS, or the CCDSO, and I will leave the link for both of those in the description box. The CCDSO is obviously in the outpatient side. CCDS has more to do with the inpatient side. So if you're interested, check that out. And that is the gold standard. Those two are the gold standard of CDI credentials. If you're really looking to take this seriously, I would look at ACDIS for that certification as well. But if I'm giving you my advice, I'm telling you, my nurses, start off with a medical coding certification, the CCS or the CCSP, and then once you've gotten that, get yourself a position in coding. So this way you can see what it's like, and that way you can kind of get a feel, and you can get your footing on what's really going on in the world of medical coding, because a lot of times nurses have they have thoughts that are really kind of not true when it comes to medical coding, or they have perceptions of how medical coding goes. I've heard from many nurses who thought that medical coding was quite easy, and when they got into the thick of it, they were in the weeds, and they were like, okay, I don't get this. This isn't as easy as I thought. Yeah. Guys, it's not. It is really a difficult field. It is not something for the faint of heart, certainly, but that is something that I would recommend for you all if you are wanting to do that. And that's just something that you can start there. I mean, that would be the best path okay, so that you can truly understand. I don't think it makes a lot of sense to go from nursing to CDI and you have no idea about medical coding. And there's a lot of people that are doing that, unfortunately. And so when those folks are getting in there just based on their education, it doesn't necessarily mean that that's going to translate to real world success when it comes to, okay, well, we're here and we're depending on our CDI, but the CDI doesn't really understand the fundamentals of medical coding. So even though they're spotting a couple of things, it's not matching up with what we need. Okay, so that's why I say to start off in medical coding, get your footing there, really kind of discover what's going on, decide if you like it, and then go on with ACTIS and their certifications, or just certification with them as well, to get into CDI. So that's just my opinion on that one. And again, I will leave those links in the description box below, so hopefully that can help you and that can guide you a little bit better. But it's in the world of medical coding, in the world of CDI, there's a lot of things that are out there that are unnecessary, as far as like, oh yeah, you need to have an alphabet. No, you don't need an alphabet. You need one certification, and that's it, to start with as a medical coder. And then when it comes to CDI, you just need one. I mean, that's really all you need. So your knowledge can speak for itself. You don't have to be showboating with the alphabet after your name, because there's no need to, especially when you have as much education as you do, right? Being a nurse and coming over and becoming a medical coder. You can also, just start there and see what the whole process is like. There may be other things that you discover that you like to do instead of doing CDI. You may decide that you like to do education instead, and there's a lot of provider educators that are needed in the industry. And so once you get into the coding and you see that maybe you like to do education instead, that is something that you can definitely pursue if you are interested in that. I will say that people who are educators or people who are trainers and teachers, they're not always trained in the art of teaching adults. So there's teaching for children, and there's teaching for adults, and there's teaching for independent study. But I think that if more people understood the importance of being trained to teach other adults, I think that education would go a lot further. It wouldn't be just about ego, and it wouldn't be just about like, I'm telling you this and you better do it. It's not that way. I always tell medical coders all the time, don't get like that with your providers, because they will shut down. It's the same thing I'll tell for my nurses. When you get like that, providers will shut down. I mean, because you're already going to have that built-in relationship. And there are some providers that are cool with that, with their nurses. And then there's others that, oh no, you're going to do what I tell you to do. So be careful there. When it comes to, oh no, this is the way I'm going to do it, and no one can change me. No one can, adjust this. You have to be willing to step back and say, okay, how am I going to change how this provider is looking at this situation, and how can I better help them, so that I can help these coders, okay? And so that's where, you got to have that. So, but you got to be humble, because a lot of times you're going up against these medical coders too, who have lots of experience. And when you are open to communicating with them, hopefully they will be open to communicating with you as well. And so that way you can make everything harmonious and be like, okay, I understand why. I understand why we need this. Or if it is not necessary, you as a nurse can explain why this is not necessary, because this guidance in the book about medical coding, and it says this, and this. And maybe you can help the medical coder to better understand. So at least that's just my advice anyway. So I'm going to wrap this one up. Thank you guys so much for joining me. If this is going to be your journey, best wishes to you. I hope that you'll like and subscribe so you can follow for more, and I will see y'all next time. Bye.